McCuistion, for over 28 years talking about things that matter with people who care. Production of McCuistion is made possible in part by individual viewers, supporters of the Foundation for Responsible Television, the Hatton W. Sumner's Foundation, helping to educate the public about the fundamental principles of their democracy and thus be in a position to help formulate public policy. The University of Texas at Dallas, creating the future.
Hello, I'm Dennis McCuistion, and there's not been an issue more on people's minds than the COVID virus for the last 12 months. The response locally has been important and something that you should know about. And joining us today will be an expert on that, Dallas County Judge Clay Jenkins. Why don't you introduce him for us, Jim?
Well, thank you, Dennis. And we're so grateful to County Judge Clay Jenkins for taking time out of his busy schedule to be with us. As you know, he's been at the forefront of leading and coordinating the local response to the pandemic, and he brings his perspective to the challenges of combating not just the virus, but also layers of political obstacles. He's held his elected position since 2011, and unfortunately, COVID-19 is not his first public health emergency, as he also led our community's response to the West Nile virus and the 2014 Ebola crisis. Judge Jenkins, we have viewers from across the country and across the world, really, and they may not be familiar with what it means to be Judge Clay Jenkins. You're not in the courtroom.
That's right. So the county judge is a vestige of the old West. It's when they hired one person in the county to do everything from trying murders to running the executive branch, judicial and legislative branches of the county back when counties were new. Now in urban areas, I'm the highest elected official in Dallas County, a county of 2.7 million people. And within the purview of that is I am the emergency management director. And so people are seeing a lot more of me during this time of the COVID pandemic.
COVID-19 was not your first public health emergency. You were involved with the West Nile virus, and certainly Ebola got global attention. How is this different?
It's different in a variety of ways. One, our federal partners in West Nile virus and Ebola were all following the science and the same facts as we were. Our federal partner up until last week in this emergency was not aligned with the CDC and National Institute of Health doctors on many things. And so that made it a challenge. It's been a lot longer than any of the others. And of course, it's obviously been much more deadly and high stakes than the others. But my staff pointed out that West Nile virus, where we lost 20 people, prepared us for the nation's first Ebola outbreak, which we had here in Dallas, and the nation's first Ebola outbreak prepared us for this. And I told them to stop right there, because if this is preparing us for anything, I'm going to retire. But
Yeah.
we're committed to getting it done.
Yeah, well, we wouldn't blame you for that, I can assure you, but we do appreciate all the work you've done. And one of the things that I think many of our viewers may not appreciate well enough is the different layers of government that we have. You mentioned the national, of course, and everybody's familiar with that, but can you sort of take us through the state, the county, which is where you are, the
Sure.
cities, which are obviously Dallas and many others in Dallas County and around, and then even other branches within those particular governments that all have an impact on this, and how you cut through this to make something happen efficiently and yet without stepping on somebody else's toes?
Sure. So it starts, obviously with the White House, and then their power vests through two agencies primarily, the CDC and FEMA. We're fortunate that the chief of staff for President Biden is my good friend, Ron Klain, who I got to know when he was the Ebola czar, and we were tackling Ebola together. And so they've got an acting director right now at FEMA. That flows down from FEMA through the regional director, who's my friend of 10 years, Tony Robinson. And then on the health side, it flows from CDC to DISHES. DISHES is the Department of State Health Services, Dr. John Hellerstedt. And from FEMA, it flows to Texas Department of Emergency Management. So at the state, you've got the governor over those departments, and those departments are answering to him, but the aid is flowing from the White House through their agencies to the governor through his agencies, to me and my agencies. My agencies would be the Department of Emergency Management, Chief Doug Bass. Also, you see a lot of city emergency managers that are working with us, like Rocky Vaz at the city of Dallas, or Chief Rodney Smith at Cedar Hill, who's our incident commander at Fair Park. And then on the shot side, it goes to Dr. Phil Huang, our Dallas County Health and Human Services director. So Dallas County Health and Human Services is the health authority for all of the cities, as well as being the county health authority.
I'm not sure how you keep all that straight, but
all of those elected officials and I train together regularly, like once a month. We train for anything from a train derailment and a chemical spill to a plane hijacking to you name it. And we have actually trained for pandemics at least every year for 10 years. So we know each other very well. And as you mentioned, we've been through a lot of emergencies together. And that really allows us, when you know and trust one another, it really allows you to move the ball quickly.
You just used the word trust, and Dennis and I have devoted a few programs to the subject of trust and how you see declining trust now in the United States towards government institutions. Have you felt that?
Oh, definitely. I have friends that I've grown up with, went to high school with, or went to college with, who believe the election was stolen from Donald Trump, believe that the attack on the Capitol was, propagated by some group called Antifa, posing as Trump supporters. And so in these days, you have alternate facts. So like, Rick Perry and I never disagreed and Barack Obama never disagreed about the basic facts of Ebola, right? But now you have political parties that can't even agree on whether it is prudent under science and facts to wear a mask, or whether it's prudent to listen to doctor advice on social distancing. So that really makes it a challenge. And my push to people is, don't listen to politicians unless the politicians are relaying to you information from the people who have trained their entire adult lives for this moment. And that is the chiefs of epidemiology, infectious disease, and public health at our major hospital systems, the CDC and the local health department. There is no disagreement whether it's from Cleveland or Houston or Dallas or Timbuktu or Washington, D.C. on the basic facts of how to keep you and your family safe from COVID. It's wear a mask, it's avoid crowds, forego get-togethers, wash your hands a lot, and get vaccinated as soon as you can.
But it's very hard now, especially with the drop in subscriptions in newspapers and in media. People don't watch TV, local TV, the way they used to. How do you get the message out?
Well, you use social media, use whatever is available to you. We're doing events in supermarkets, barbershops, and different things to get people signed up for the vaccine that aren't using the internet and the toll-free phone number. And so, any way you do it. And I will say this about the media, the media gets bashed a lot by people, but the media have been absolute heroes in the response to COVID, because if not for the media, whether it be traditional bloggers, newspapers, television, getting out the information, we would be in a far worse place than we are now. And so this is really a time where people should be adding the media to that list of healthcare heroes and frontline responders that have helped keep them safe.
Yeah, the situation is, of course, we know about the problem, as Jim mentioned, of trust of the federal government. Our friend Tom Luce, who you know, of course, with Texas 2036, they just came out with a new study that shows, a new poll that shows that people in Texas trust the Texas government less than it was before. We had, Jim and I had Philip Huang on a program before COVID that talked about vaccinations, and the fact, as you know, Clay, that so many people are concerned about vaccinations, and yet today we have that same concern in this situation. What do you do, and how can that viewer watching this program help this situation to at least alleviate that part of getting vaccinated? Not to mention the let's just say the technical problems that we have in getting people vaccinated.
Let me just allay some fears here. This vaccine, the two that we have now, Moderna and Pfizer, are 95% effective after your second shot in protecting you from COVID. That's a little like birth control. We all know people who've had a surprise baby on birth control. It's not foolproof, but 95% is good protection. And the side effects of this are relatively mild. Millions of people have now been vaccinated in America with very mild side effects. I myself have been vaccinated here recently. I waited because I didn't think it was appropriate for politicians to jump to the front of the line. But when it became apparent that I would be around 2,000 or 3,000 people a day getting our vaccination centers in order, then under 1A as a vaccine, as a mass vaccinator, I was vaccinated. Mild symptoms, I wasn't afraid to get it. You shouldn't be afraid either. The things that a lot of people are allergic to in vaccines, like eggs or a fear that they'll get COVID from the vaccine. There's no COVID in the vaccine, and there's no eggs in the vaccine. Only if you've been allergic to other vaccines, is there really anything to worry about? And we take care of that with an interview with you before you ever get vaccinated. So please sign up. And for the viewers here in North Texas or anywhere in Texas, every state vaccination site is open to everyone in the state. So if you're in North Texas, you want to sign up with Dallas County, which gets you all the major hospital systems, the county and the city of Dallas, Garland, and then Tarrant, Denton, Collin County, and the city of Frisco. And if you don't mind driving, you want to sign up at Tyler as well. Some of those vaccine sites are using the vulnerability and proximity scale from Parkland Center for Clinical Innovation. What that means is if you're in a neighborhood with high spread, or if you are one of the more vulnerable people, you're going to get a shot sooner. Others are using a first come, first serve basis. So the sooner you sign up, you'll be reached. So you want to sign up everywhere. For people that are 35 and relatively healthy, one might be better than the other. 75 with diabetes, the other is better. So sign up everywhere.
But is our systems working well enough that if I've signed up on 4 or 5 sites and then get the vaccine, is my name taken off that list everywhere else?
Not yet. So the state is working on that. The way it's happening in Dallas County right now is we're doing it by hand. John Heller, the Commissioner of Public Health for the state, sends us a list and we go by hand and try to, pull that off. I've got a special called meeting later today or in the morning to hire a management system that will be able to do that better. The state is trying to get their management system too. Then once they get that up and running, it'll work a lot better.
Well, I just got my first shot about 3 or 4 weeks ago. My second shot is tomorrow.
Great.
Clay. So, Jim, I'm not sure where you are in this process right now.
I have my first one and I'm 2 weeks away from the next, as of today, in fact.
You're both slightly ahead of me. So congratulations and get that.
Well, that's because you still have hair and it's not great.
Yeah, I guess so. The issue of what's happening here in terms of efficiency, Jim and I did a recent program with Adrian Wooldridge and John Micklewith, if I can pronounce this name correctly.
Yep.
Okay, great. And one of the things that they were concerned about, Judge, is the fact that America has been, let's just say, not as efficient as we could be versus some other countries. And so the things that you talked about in terms of the various layers of government and the ability to communicate between county to county, et cetera, how can we make this better so that we don't have this same issue come around again?
Well, so on the local level, I think what you've seen is a very good communication between the counties. For instance, the city of Dallas was over at my site looking at things to improve and get ready for K. Bailey Hutchinson. We've sent people to Denton to look at their site. We've been out to Tarrant County to look at their sites. They've been over to look at our sites. Denton's been to look at our site. And we communicate regularly. The local government response works very well. One of the impediments to that this year has been when we began, things were working very well. When the governor came in and stopped some of the local governments from being able to do the things that were necessary to protect their populations, then that hamstrung us a little bit. And I think when it comes to trust in government, what we have seen over this year, and it's instructive for as we move forward in the future, elected leaders who have consistently followed science have fared best in getting it right and in public trust. And when elected leaders who've done both have followed the recommendations of the medical experts, they've done well. And when they have followed the pressure of different constituency groups, they've done poorly. I think a lot of the public distrust stems from, for instance, the fact that there are bars open all over the Metroplex where people are dancing maskless until 2 a.m. And we have been stopped from being able to close those down, even though our doctors tell us those are super spreader events. And so our trust has been high when we've listened to doctors, because that's public health requires a medical response, a scientific response. Viruses don't lend themselves to political, compromise. They only lend themselves to following science and facts, unfortunately.
Clay, what has been the financial cost, an estimate of COVID-19 to our county, and how you've had to reprioritize the budget?
Oh, it's been tremendous. Now, that first CARES Act has helped quite a bit with that. And, I'm hopeful that we'll see more money coming in, particularly for vaccine distribution. But the cost that concerns me the most are the costs to small businesses and employees who've lost their jobs or haven't made as much money, small businesses that may fail because of this by no fault of their own. Again, I think if we follow the science, for instance, we had a choice this summer in, do we want bars to be open or do we want everything else to do better, right? So if we follow the science, our businesses tend to do better. And I think those businesses like bars that should be closed right now, they need particular help, a particular special program, a PPP specific to them, if you will, that is different from other businesses because they need to be closed. But there's been a lot of pain out there, no doubt.
No doubt. You didn't sign up for this. What has been the impact on you, your family? We've heard in some cases of death threats against elected leaders. Tell us about what it's been like for you.
So we do get our share of threats. And so, my suggestion to you, if you want to send us a threat, try not to do it on social media. That just makes the police job too easy. But we do get our share of those, but that comes with the territory. I think the secret to kind of staying sane in all this is I wake up every day. I have the first 15 minutes of my day, no matter what is going on. I spend and have what I call quiet time. You know, not to be religious on television, but I read a thing called 365 Promises, send it out to a lot of my team. And in that 15 minutes, I'm praying for people that have asked for prayers, praying for my team to do good that day. And I'm thinking about what kind of leader I want to be that day, not the problems I'm going to face, but what kind of a man I want to be that day. That helps through the day a lot. And then, you know, if you were an emergency manager, you would know this by heart because I ask them this every time and I make sure I'm doing it. Are you sleeping? Are you eating right? Are you exercising? Spending time with people that you love, laughing out loud every day, and engaging in intentional thankfulness, finding something to be thankful for several times a day. I think when we do that, it puts us in a place where we can survive the grind of stress that is responding to this.
Well, one of the things that you may know, Clay, I'm certain that you watch this program every week. And if not,
I do watch it some, yeah.
I appreciate it. Well, you know that one of the things that Jim and I have done in the last 10 or 12 months is we have focused on something that you mentioned that's so important: mental health issues, addiction issues, opioid issues, suicide issues, things like that, that have been, let's say, unintended consequences of people having to stay home. And so I appreciate what you're doing with your team, and hopefully that viewer who's watching can encourage their group to do the same thing.
Yeah, let me say this to you. After the police shootings, one of the first things that Chief David Brown and I did is we publicly went to see counselors. And that was to encourage others who had been involved in the decision-making process to end the life of the shooter to do the same. And if you need help, get help, okay? If a friend of yours says something about they wish they were dead or they're thinking about killing themselves or whatever, that's not a joke. And you can Google questions to ask at Mayo Clinic, questions to ask people who are considering hurting themselves, and ask those questions. If your friend needs help, help them. Look in on one another, and if you need help, get help. It doesn't make you less of a strong person that you need help any more than it makes you less of a strong person that you need to go see a doctor if you're running 102 fever.
You know, we have just another minute or two, and you've mentioned Governor Abbott a few times and about how he's opposed many of the mandates that you wanted to put in place. Are you seeing better communication now with his office now that we're not in an election year?
Yes, I have a real good communication with Department of State Health Services. And I think the governor is doing a good job getting the vaccine as much as he can get and then getting out of his hands quickly to local governments and letting them have the flexibility to get that to their people. And again, I think the governor has done well when he's followed the advice of science, and where he's fallen short, you know, a tweet with beer steins clinking together, opening bars right before the second wave comes to mind. So when he's diverged from the doctors, he's done badly. When he's followed the doctors, he's done well. And that's the way public health works. The virus doesn't care what political party you're in. It's only going to respond to 100% fealty to whipping it, because, you know, we're in a race right now. You know, Jim, as you know, the virus is trying to work its way, replicate, and change its way into those vaccines not being effective. We're trying to get to herd immunity before that happens. And we've got to control spread while we do that. So everyone's got to work together. We've all got a role to play. Everyone's role is to follow those ways to not spread COVID.
What's your goal? When do you think we might reach herd immunity in Dallas County?
To get to herd immunity, the doctors tell me you need about 75% of the people to be vaccinated. Right now, obviously, with 43,000 vaccines coming in a week to our mass vaccination centers, it would take a long time to get there. But Johnson & Johnson's up for approval in February. That's a one shot. It started out being a 2-shot, but it's a 1-shot. So that would double our capacity right there if that's approved. AstraZeneca is already being used in India and Great Britain. If they get that one in here, that would be something. I think when the president has now done the Defense Production Act, that will have a big impact. For instance, if we had 1 cc needle of 1 cc syringes, which we don't have right now, we have 3 cc, we could get 1 to 2 more doses out of each vial.
Well, that would be a big step. And I just have to say, you and I have known each other for a number of years. We really appreciate the work you're doing. As I said, you didn't sign up for this, but we sure are glad that you're there in the commissioner's court, and wish you all success, because your success is our community's success. Thanks for being with us today.
Thank you. Thanks for your work on the World Affairs Council. Thanks for your work here. And again, I'm a viewer and appreciate the work that y'all are doing, getting the accurate word out.
Thank you.
Thanks, Judge.
Stay safe.
Well, again, Judge, thank you so much for joining Jim and me to talk about this most important topic. And for those who watch this program regularly, you know that we provide different perspectives on things that matter with people who care. And there are a lot of perspectives on COVID-19. Our job is to give you as many of them as we can. We hope you'll follow us on McCuistionTV.com for other subjects similar to this. And also, of course, follow us on Twitter. Thank you so much for inviting us in, and we look forward to seeing you every week.
For more information, call 214-750-5157 or email Nikki N at nikkimcquistion.com. Visit our website at www.mcquistiontv.com. You can also follow us on Twitter at www.twitter.com/McQuistionTV or download McQuistion TV video podcast on iTunes. The Hatton W. Sumners Foundation, helping to educate the public about the fundamental principles of their democracy and thus be in a position to help formulate public policy.